Now, the United Nations is proposing an economic lifeline to people living in poverty during the coronavirus pandemic. In a report, it says they should urgently receive a basic income that would cost developing nations a total of $199 billion a month. To pay for this, the UN suggests a temporary debt freeze for 132 nations. Then they can use that money to combat the effects of COVID-19. The UN predicts this could potentially help 2.7 billion people globally, and it means they won't be forced to work, and staying at home will reduce the risk of the virus. The UN says the pandemic has been particularly devastating for poor communities. Well, to talk to us about this is Achim Steiner, who's an administrator at the United Nations Development Programme and joins us from New York. Thank you very much, Mr. Steiner, for being with us on Al Jazeera. So your report, the UNDP report, makes the case that a temporary basic income would help 2.7 billion people, the poorest people in the world, retain an income and helping them to stay at home, which would help to stop the spread of coronavirus. But how do you convince rich nations, developing nations, whose economies have also been hard hit by the pandemic and who've been seeking bailouts, to sign on to this plan?
Well, first of all, it is a plan and an analysis that is based on our assessments that we have undertaken as the United Nations across more than 80 countries now in terms of their COVID-19 response, but also on how to manage mitigation measures. And as the pandemic is spreading now and it is gaining in pace, it is particularly also moving into countries of the global south. And there, our sister agency, the International Labour Organization, estimates that 70 to 80% of people earn their livelihoods in the informal sector. So the very measures we need to take to contain the virus that each country has to put in place also have an immediate, and particularly in poorer countries with no social safety nets and protection systems, a catastrophic impact. So the ability to contain the virus in the absence of a vaccine for the next 6 to 12 months is clearly a major priority. And based on what we have observed, quite a number of countries in the developed world already have temporary basic incomes, what we call unemployment insurance, temporary furloughs that allow people to maintain their income, then return to their jobs. In many of the developing countries, that safety system is not there. So countries must now look at options of how to enable people to follow the pandemic containment strategies without having to starve, because that is the prospect that literally hundreds of millions of people face. It is principally, first of all, an option for countries themselves to consider. It is not a global fund into which one group of countries pays and others draw down.
Okay.
But what is important is that the fiscal space in developing countries clearly is constrained, particularly for the poorest ones. And that's why we made also the link to global debt. The developing world, emerging economies, developing countries will have to repay up to $3 trillion in interest and repayment of loans this year. And that's one possible source.
Right. But if you say that debt structuring will be one way to ensure that the world's poorest get a basic temporary income, isn't that just going to kick the debt problem down the road and effectively keep the poorest countries poorer for longer and giving them an additional fiscal problem to still deal with the pandemic after it's been resolved?
Well, we are facing an extraordinary situation. The reality is that so far the developing world has largely been left to on its own to cope with this situation. We have seen the IMF and the World Bank providing additional credit lines, but the international response so far in supporting particularly poorest countries is still wanting. And that's why I think we need to give countries an option of examining how through their national budgets they may be able to put schemes like this in place. And we have seen examples. Togo putting a cash transfer program in place in just 8 weeks. In Pakistan, over 109 million people being reached with $1.2 billion from Pakistan's national budget. Countries are desperately struggling to figure out how to protect the poor and to avoid many from falling into extreme poverty. Without some form of temporary basic income, basically there is no scope for putting the containment measures in place. And so the virus will continue to spread. This is why we're saying, first of all, governments themselves need to look at the viability of these schemes. And basically, a temporary basic income will cost, on average, less than 0.5% to 1% of GDP. So in terms of financial viability, it is not out of range. The question is, can it be implemented quickly? Could poorer countries in particular benefit from a debt standstill? And yes, maybe that's restructuring forgiveness. But we are facing a situation where fiscal space, the ability to spend through national budgets right now, is fundamental to managing this health crisis, but also a rapidly escalating economic and social crisis.
Thank you so much for speaking to us, Achim Steiner with the UNDP, joining us there from New York. Thank you for your time.
Thank you.